Our topic today is food sensitivities, why and how you should do an elimination diet. This is a skill that I think is very important for anybody who has autoimmunity, inflammation, MS. So here's what we're going to talk about. We're going to talk about why food sensitivities are so common with people diagnosed with MS and autoimmunity. We're going to talk about how food sensitivities start, testing. What kind of testing is there? Why should you think about all the different ways you can approach this? We're going to talk about how to do a diet. And then finally, I'll touch on that 5R protocol for leaky gut repair that we in the world of integrative and functional medicine use to bring the gut back into balance. And then at the very end, we're going to have a live Q&A. So grab a lot of questions for us. And then also, please be sure to stay to the end. We actually have a couple of really fun offers for you that I think you'll like. All right, so I wanted to talk to you about this recent study that was done looking at the connection between food allergies, environmental allergies, drug allergies, and MS progression. Okay, so what they did was I think they took about almost 1,400 people, and these people either had a drug allergy, a food allergy, or environmental allergy, and they also had a control group where these people with MS didn't have any allergies, and they looked to see what their rate of relapses and new lesions on MRI was. What they found was that those who had food allergies were more likely to have relapses, and they were more likely to have lesions in the brain that we could detect with contrast, the gadolinium that we all get when we go and get our annual MRIs. And this was significantly higher when compared to the MS patients with no allergies. So clearly something's going on. When people report food allergies, there's something happening at the level of the immune system that's impacting demyelination. And so this is an important concept to keep in mind. In fact, I think their rate of having these progressions in MS was about 1.38 times higher, which was statistically significant. So let's just kind of do a quick background. There are many different kinds of food reactions, and not all of them involve the immune system. There's anaphylaxis. Those of you who may have this know it, and you know what foods are involved. Anaphylaxis. I personally do. There are about 4 nuts that I cannot go near because within 5 seconds of contacting it, whether someone kisses me on the face or I accidentally eat it, I feel like I'm going to die. It's like 5 seconds. It's not delayed at all. And it is severe. You will feel ill. Your GI tract will go crazy from above, from below. You'll have abdominal pain and cramping. And you can also have a lot of airway swelling. This is a reaction of your immune system pouring out IgE antibodies. It is quick and the symptoms are severe. So people with anaphylaxis know it. There's no question. There are food intolerances. Some of you here might actually be lactose intolerant. Many of us, as we become adults, lose our enzyme that helps us break down lactase that's found in dairy products. So because we lack that enzyme that we haven't, used, and so it just sort of becomes less prominent, we don't process dairy products well. This is not a reaction that's mediated by the immune system. It's an enzyme problem. So food intolerances, just the immune system is not involved. What we are going to focus on is food sensitivities. Unlike anaphylaxis that involves IgE antibodies, food sensitivities involve IgG antibodies. These antibodies are slow to increase in the body, and the symptoms they cause are subtle. And so they're much harder to detect. You don't get sick within 5 or 10 minutes or even an hour. It might take longer. It might take half a day, 2 days. And the symptoms might just be a little rash, a little abdominal pain. Maybe something happens to your skin. Maybe your mood's a little off. So these are hard to pick up. And this is what we're after because it's one of the factors that drives the immune system to stay active and to create inflammation and to constantly react to things that it comes in contact with. So I want to talk about this concept of immune tolerance. It is really central to understanding autoimmunity. So your gut is tasked with bringing in food for nutrients. It's also tasked with keeping out dangerous things like viruses and bacteria. The immune system and the gut are intricately connected. As soon as something crosses the lining of your gut layer, it's going to contact the immune system. And that's really important because that's your second checkpoint to make sure that the thing that entered is truly safe to enter. So it's your second layer of protection. And so the gut and the immune system are always constantly communicating with each other. Immune tolerance is something that your immune system has to learn, and it starts probably in utero when your mom was pregnant with you. As our immune system gets exposed to different things, it learns what to attack and what to leave alone. And this is really important, right? So you want to attack viruses, bacteria, worms, parasites, maybe even toxins or molecules that are man-made and not really natural. But you do want to leave alone food and your own tissues, your body. Because if you start attacking food by making antibodies to it and then attacking it, we call that a food sensitivity. If you attack your own tissues because you have now developed tissues to your joints or to your myelin, that's called an autoimmune disease. And so the immune system needs to learn what to attack and what to leave alone. And guess what actually helps it do that? Early life exposure to a lot of ordinary bugs that don't make us sick, that don't cause disease. This is why we don't want to live in sterile environments. This is why it's good for kids to play with dirt. And so this is an important educational period, and it actually continues throughout life. Also, our gut microbiome, those good bugs that live in our large intestine play a role in creating immune tolerance, tolerant to not attacking food and our own tissues. Now, there can be loss of tolerance. For whatever reason, your immune system gets confused and it starts making antibodies to food and to your tissues. And now you are left with food reactions and autoimmune diseases. And this is partly why people with autoimmune diseases also have higher rates of food reactions. It's the same foundational imbalance. Your immune system's forgotten the rules. It's forgotten what to attack and what to leave alone. And so it's not a big jump to go from attacking food to attacking your own tissues. So now let's talk about leaky gut. People love talking about leaky gut. It's like a buzzword you'll hear if you are anywhere within holistic, integrative, functional medicine. I want to show you what leaky gut looks in this artist's rendition. We can actually visualize this under very powerful microscopes, but it's not yet in clinical practice. So imagine that the top white area is the tube, the hollow tube inside your GI tract from the mouth to the anus. And this is where food travels and it gets digested, and what needs to be absorbed is absorbed, and the rest comes out the other end. So as food travels through this lumen of your GI tract, it's going to come in contact with the small intestine. Right after moving out of the stomach, it goes into the small intestine. There are a single layer of cells that line this tube that is your GI tract. And you have these little finger-like projections called villi. And on these villi are little receptors. And they're basically just little feelers that your cells put out to see what's coming through. And if the shape fits, it'll grab that thing, whether it's food or bacteria or whatever, and it'll pull it into the cell. So if something wants to enter the small intestine, it has to bind one of these fingers, go through the cell, and then hit the immune system here, which is that brown line, before going into the bloodstream. That's how it normally should work in a healthy gut. And if you notice, these cells are nicely adhered to each other with these proteins called zonulin and some other proteins there that we can actually measure in blood tests. And Dr. Roberta will tell us more about that in a little bit here. So normal scenario, all the cells are nicely adhered to each other. If something wants to enter, it has to go through the cell, get past the immune system and into blood. Now look at this scenario to the right where the proteins have broken down. There are spaces between the cells. They're no longer touching each other. And unwanted things, partially undigested food, man-made toxins, or even toxins made by bacteria, for example, or the bacterioviruses themselves, now can bypass that first step of binding the villi before they enter. And so now they're leaking in, you have a leaky situation, and now you hit the immune system, which is your second checkpoint. You can imagine if these cells are not tightly adhered to each other, that lots of things are going to get through, and the immune system is going to start seeing a lot of things coming through, which feels like a danger signal to the immune system. It's not supposed to see so many things. And so the immune system goes, something's wrong. I'm sensing danger. Let me turn on my defenses, turn on inflammation, make antibodies so that I can protect this person, right? So this is what leaky gut looks like. And what we would want to do is to go back to this scenario. And it's very much possible by doing a gut protocol that we'll talk about at the end. So just to summarize, leaky gut is a breakdown of the small intestinal lining. So you have this situation to the right. You've lost your ability to regulate what enters the body. Things that need to enter, like nutrients, may not enter, and things that are unwanted can now enter. And your immune system gets overstimulated and revs up its defense mechanisms. So why are food sensitivities so common in people with autoimmunity and MS? Well, in functional medicine, we actually talk about 3 things you need to get an autoimmune disease, and one of them is leaky gut. It sets you up for an immune system that gets confused and attacks your own tissues. So you get leaky gut, you lose tolerance. The immune system forgets that it's supposed to leave food and our tissues alone, and what you end up with is inflammation, food sensitivities, and autoimmunity. So I hope that gives you an understanding of why this happens and why autoimmunity and food sensitivities are so often found together. So how do food sensitivities start? Let me tell you a story. So you have to have the wrong conditions where you may not have enough stomach acid for a variety of reasons. Maybe you are on medications that suppress stomach acid, or you have autoimmune gastritis, or because of aging, stomach acid is impaired, and that means you're not breaking foods down as you should. These larger, partially digested food molecules continue to move from the stomach into the small intestine. And if you have a leaky gut, they're going to start moving in and then stimulating the immune system, okay? And now you're producing antibodies against food. So this is how we think food sensitivities start. And there are multiple areas here that we can actually intervene in. Perhaps we can improve stomach acid secretion. Maybe we can close up the leaky gut so that food particles that are larger aren't getting through. And we can also practice lifestyle habits that calm the immune system down so it's not constantly revving up inflammation and antibodies. So how do you know if you have a food sensitivity? I'm not talking about the IgE anaphylactic type. I'm not talking about the food intolerances. I'm talking about the ones that are subtle and slow to onset, so easy to miss. So these are your food sensitivities that involve IgG antibodies. And the symptoms can include anything from gastrointestinal to skin problems, asthma, respiratory sinus issues, migraines, mood, energy problems, fatigue, disruptions in sleep, appetite. So also autoimmunity. Maybe your only symptom of a food sensitivity is that you have an autoimmune disease, okay? So if none of these pertain to you, I would still recommend that you dig deep because they are hard to find unless you're intentionally looking for them. So let's talk about testing for food sensitivities. There are many different ways you can go about this. Have any of you gone into your dermatologist's office and they go, sure, let's stick this like tray of needles on your back. Each needle has something on it that's going to enter your skin. You wait 15-20 minutes and see which of the foods that you tested reacted. So skin testing is one way to go about looking for food sensitivities. How accurate is it? Well, it's really just looking for a reaction in your skin. It's actually not telling us much about what's happening at the level of the gut. So I think there's a limitation there. And I can tell you from my own personal experience and patients that I've seen, the symptoms don't, the person's symptoms and food sensitivities don't always correlate with what's found. Like, for example, I do react to black pepper, but on that test, it did not show that I had a reactivity to black pepper. So it's not very accurate. There's IgG blood testing. This is something you can actually do to see if you are making antibodies to certain specific foods. So the panel may include, there's many different kinds of panels. I've seen anywhere from 20 foods to 50 to 100 foods. And what the test is looking through a blood sample is looking for IgG blood testing. Coach Roberta, do you want to say anything about this?
Yeah. I think, and like you were saying, it's with those reactions, like taking sometimes up to 3 days to occur. Testing really help us. It kind of shines a light of what to pay attention to, right? And so, and I'm happy to share a test once we're done with this presentation, like a sample, so everyone can see. And yes, and there are so many different tests in the market right now. And there are a lot of variables. The test that we use together is the KVMO, which not only tests for IgG, but also IgG and complements. So in that complement, C1 to C3, that's where we see a lot of positivity that not always show in other different tests. So I'm happy to share more of that for those who wants to stay and learn more about the test later. Yeah.
Yeah, we'll talk about that at the end. So why would you do the blood testing? Because for people that have complex histories, lots of food reactions, they don't know how to prioritize which foods to test, or they're unable to do an elimination diet. I think it's reasonable to do blood testing as a starting point to see what you're dealing with. And I often find that when people find many food sensitivities light up on these tests, that usually means you have a leaky gut. I always say it's not the food's fault. There's just something at the level of your gut that's allowing you to produce antibodies to so many different foods. So IgG testing can be helpful, and we'll talk to you more about that. And then there's the elimination diet, which actually is the gold standard. And that's what we're going to focus on today, on how to do an elimination diet and why it's important. So this is where you remove foods, let things cool off, and then you reintroduce them back in. Okay, so let's see here. How are you going to identify your food sensitivities? So this is going to be something that's going to take some time. You need to find a period of maybe 6 to 10 weeks where you're not traveling, you're not going anywhere, where you kind of have control over your food. What we need you to do is choose the foods you're going to eliminate, and you eliminate them for 3 to 6 weeks. And then you look to see if your symptoms, whatever they might be, improved over those 3 to 6 weeks. And then the second step is the re-challenge. This is where you reintroduce the food to see if your immune system now recognizes it and gives you a reaction. So there's two phases. There's the elimination phase, and then there's the re-challenge phase. So how do you do an elimination diet? Let's go into a little bit more detail. During the elimination phase, the first thing you need to do is to decide what foods. I would say, if you want to make it simple, you start with the foods here: gluten, dairy, corn, soy, eggs, sugar, alcohol. We can talk in a bit here about how to actually get even more granular, but you're going to choose the foods you're going to cut out. You're going to do it for 6 weeks. And here's the really important part. You're not just eliminating foods out of your diet. You actually have to replace those foods with healthy alternatives. Lots of plant-based foods like whole grains, fruits, vegetables, nuts, seeds that are going to produce or provide the building blocks for rebuilding your gut lining to heal that leaky gut. So the elimination phase should be at least 3 weeks, but ideally 6 weeks to get you to a place where the antibody levels have dropped because you've stopped eating that food, and then things have cooled off. You're starting to feel good. And then once you've done that, then you're ready to reintroduce at 6 weeks. I will tell you, the first 3 weeks of an elimination diet can be very challenging. You're getting used to new foods that you weren't eating before. You are missing the foods that you love eating, like your gluten and your dairy and all of the foods that are commonly in your diet that maybe you have cut out. And so people feel really good in weeks 4, 5, and 6. And this is why I encourage people to really stay the course and get to 6 weeks. And so if you've gone to 6 weeks, then you go for a reintroduction. Now, the standard reintroduction I do with people is pick the food you miss the most, or the one that would make your life easiest if you were to reintroduce it back in, and then you eat it 2 to 3 times a day for 3 days in a row. Because what you're trying to do is you have let the immune system cool off, and now you're putting that food back in that you suspect your immune system has learned to make antibodies to. And if it's going to attack it, you want to make sure that you're putting enough food in that you get enough attack and enough symptoms and enough inflammation that you can detect a symptom. So that's why we reintroduce heavily over 72 days. There are people who are very sensitive, so I have them do a slower elimination over 7 days. And so if you reintroduce and you find that a symptom comes up, then that may very well be an indication that you have a reaction to that food, that you have a food sensitivity. And as I said, the symptoms could be anything. So which foods should you cut out during an elimination diet? So I would say the highest suspect foods are gluten and dairy. Those would be my top 2 things. If you're going to do nothing else, at least cut out gluten and dairy. You will likely find that you feel better when you're off of them. Now, not everybody has gluten and dairy sensitivities, but many people do. Also, corn, soy, and eggs. And what these foods have in common is that they're found very commonly in our diet. So it's just your immune system has more access to reacting to them, to seeing it, identifying it as a foreign invader and building antibodies to it. Now, in addition, when we do our gut restoration protocol at Truemedicine, we actually expand this further. In addition to the foods on the first line, we also have people cut out sugar because it's just inflammatory. Beef, a lot of people do react to beef. It's also hard to digest. Shellfish is a problem for many people, as well as coffee and alcohol, which a lot of us get a little bit too comfortable with, and we use them regularly, whether we are medicating ourselves because of headaches or low energy or anxiety. And so we try to come off of these foods as well. Also, we want to make sure that you're on a healthy diet. So we have people, in addition to eating a plant-based diet, removing artificial flavors and colors, processed foods. We just want you to eat real food because that's the most efficient way at rebuilding the gut. And there may be other suspicious foods because a lot of people do react to nightshades. These are tomatoes, potatoes, peppers, eggplants, as well as beans, nuts, seeds, you name it. There's really no limit to what someone can react to. Like there isn't any food that's off the table. So I let people sort of personalize this for themselves. I think if in a round of elimination, if you can do the first 3 bullets, then down the line, you can remove nightshades, beans, nuts in a separate round of elimination. So that's how it's done. So this is a process that could take a long time, but you could make it simpler by doing it in different phases. All right. So what are the benefits of an elimination diet? Well, aside from identifying your food sensitivities, which is important because if you keep eating these foods, you're going to keep causing gut inflammation. You're going to keep revving up the immune system. And now you have an immune system that's amped up and not terribly helpful to those of us with MS and autoimmunity. It helps lower inflammation, and it's an opportunity to try new foods and new ways of eating and cooking and preparing foods. So it really does expand how you interact with food, and it really does change your relationship to food. I've done elimination diets with my kids. Remember during the reintroduction, we were at the very end, we had reintroduced everything. They weren't really reacting to anything. And my 4-year-old at the time, it was his birthday, and he said, "Can we go to the Cheesecake Factory?" I said, "Sure." We went. And I do remember on the car ride home, all 3 of them, they were 2, 4, and 6 at the time, were complaining about how bad they felt because they had been eating clean for so long. And then they had burgers and cake and, everything you could imagine that would not be on an elimination diet. So even kids can tell after an elimination diet when they feel bad, when they start eating foods that are not so healthful. Okay, so safety first. For anyone who has blood sugar issues, whether it's diabetes or borderline diabetes, low blood sugars, unstable blood sugars, I want you to be very careful with doing an elimination diet, because if we all of a sudden cut out the carbs and the gluten and the sugar in your diet, and you are on medications and supplements that help lower blood sugar, you can go too low and you can have a very bad outcome like death. So if you are on any medications or supplements to lower blood sugar, please be very careful. Talk to your doctor about what you can do to safely go through an elimination diet. Basically, what you'd want to do is do it very gradually. If you are on a very narrow diet already and you have lots of food reactions, I would be very careful about cutting out more foods out of your diet. I do have patients that eat 5 or 10 different foods, and that's all they can do. And it just doesn't sound reasonable to me to say, why don't we cut out a few more of those few foods that you're eating? A narrow diet is not good because now you're missing building blocks for all the things that your body needs. If you have a history of an eating disorder, anorexia, bulimia, anything else, please be very careful. What we don't want is to kind of wake up that eating disorder that maybe you have worked really hard to manage. And so if anything here fits, please talk to your doctors before pursuing an elimination diet, because there are other parts of the protocol that you can focus on and not necessarily the elimination phase. Okay, so there is a thing called the 5R protocol that is used by integrative and functional medicine providers to heal leaky gut. And it's not just for leaky gut. It can actually help heal the gut at any level. I've had patients with a lot of esophageal inflammation because of constant acid. And we've used the protocol to heal that. They've gone back in, had an endoscopy, and the doctor said, well, I don't see inflammation and redness anymore, right? So this can work for, anything from the esophagus all the way down to the end of your colon, right? I've used it with patients with inflammatory bowel disease, ulcerative colitis, and Crohn's disease to help calm things down. So it's a big protocol. The first step of it is called, there's 5 R's. The first R is remove, and the first step of it is the elimination diet. So removing the things that are damaging to the gut. So if you continue eating foods that you're reacting to, it's going to be really hard to heal leaky gut because there's ongoing inflammation. So let's remove the things that are damaging. So that would be food sensitivities. The other thing that I do work with patients is removing infections. So it could be, doing a stool test to see if there are microorganisms that need to be dealt with. I generally don't run that test on everybody unless there's a travel history that makes me think that there's a microbe at play. But sticking to the elimination diet as the first step actually is highly impactful. It's very high yielding because it helps remove the factors that are damaging. The second R is replace. So let's bring in the things that the gut needs to do its job. This could be from supporting stomach acid to supporting digestive enzymes that come from the pancreas to making sure that there's enough bile or bile salts, bile acids to help with fat digestion. I find that these factors are often low in people with gastrointestinal symptoms or autoimmune diseases. So we bring in the things that the gut needs. The third R is reinoculate. This is a fancy word for saying bringing in the good microbes into the gut microbiome in the large intestine. So how do we do that? Well, there's the addition of foods like prebiotics and probiotics. And as we eat these foods, we start boosting the gut microbiome, which is really important for MS and autoimmunity. And then there's the repair phase. How do you repair the lining of the tissues? There are therapeutic foods you could use, like bone broth and lots of plant-based foods. There are also some supplements that come in here. And so, going through the repair phase helps actually bring those proteins back that adhere the cells to each other. And then there's the rebalance. This is actually probably the hardest step of all. This is the rebalancing of your life. How do you continue to manage stress, get good sleep, eat good food, move your body, avoid exposure to toxins so that your body can be in a more balanced state, right? And this actually takes a lot of effort. It's really a lifestyle, right? To start living in a way that's supportive of your health. So this is the 5R protocol. And it is a big protocol. It is hard to do on your own because people get stuck. It's not as intuitive as you would think. And so a lot of people work individually with functional medicine providers to get through the protocol. But it's expensive, as you all know. A lot of insurance companies do not cover these visits with these providers. And so it's hard to get the support that you need. So what's the solution here? What's the answer? I struggle with this problem of access because of cost and access to a provider who could do this with you, because I think it's unfair that we hide this information behind very expensive providers. And so one of the reasons I've created Truemedicine is to bring this information to people who want it. It's not easy because it's not as simple as just taking a pill, a medication, or a supplement. It really does have a lot to do with changing your small decisions throughout an ordinary day to help you get through the protocol. And it's a lifestyle and it works. The gut is dynamic. It can get damaged over the course of a few weeks to months, but it can also heal. And so sometimes people will say, after I had COVID or after I had a GI infection, like my gut was never the same. Well, perhaps what happened to you was the trigger for throwing off your gut balance, putting you into leaky gut. And now we have to work on getting everything back to a better place of balance.